السلام عليكم ورحمة الله وبركاته. معكم اليوم الأستاذ محمد. اليوم طبعا معنا في استضافة الدكتور أمان. طبعا الدكتور أمان مختص في علاج واستبدال المفاصل وأيضا في عملية جراحية للعمود الفقري. أمان لديه خبرة أكثر من 28 عاما. طبعا اليوم سوف يتحدث الدكتور عن استبدال مفصل الورك. Hello sir, how are you? Today our viewers they want to know about the hip replacement procedure and what is the best material to use for the hip replacement.
See, hip replacement is required when the ball of the hip joint is damaged. They had a fracture or there is a condition called avascular necrosis. There is a condition called sickle cell anemia, blood disease. Because of that sickle cell anemia, there is a high risk of avascular necrosis. And AVN happens mainly in younger age. It's a very painful condition. That's why the surgery is required for the relief. In elderly patients also it can happen. What we do in the hip replacement is we just 4 components. There is a socket which goes and inserted into, it's fixed into the pelvis.
Yeah.
Okay, we call it acetabulum. Then there is a plastic component which goes and locks. Okay, then there is a head inside. So the movement happens between this head and the plastic. And then there is a rod that goes inside the femur bone. So the movement that happens between them. When you talk about the material, best articulation is ceramic head with a cross-linked poly. We have seen very good results and very long results. Wear and tear is less with them, so the implant should last. These days, the bigger head sizes are available, 32 mm, 36 mm. They prevent from dislocation.
Our views, they are speaking about the how many they have to stay in the
hospital stay is only 3 to 4 days after the surgery. For our international patients, we advise them to stay in Delhi for around 2 to 3 weeks. We can observe how their skin is healing, how the wound is healing, and whether their physiotherapy or their rehab. It's mainly the precautions what we need to follow up. Hip replacements, they recover much.
طبعا اليوم الدكتور تحدث عن حوالي استبدال مفصل الورك. طبعا مفصل الورك له اسباب عديده، هو بسبب هشاشة العظام او بسبب مرض الانيميا المنجليه. طبعا استبدال مفصل الورك هو اسهل. في مفصل الورك مغطى بالسيراميك والبوليثيلين معها، فهو افضل من انواع المفاصل الورك. طبعا مده البقاء في المستشفى هو 4 ايام، ومده البقاء في الهند من اسبوعين الى 3 اسابيع، ويحتاج الى علاج طبيعي لكي يستطيع المريض ان يعود الى بلاده وممارسه حياته الطبيعيه بشكل طبيعي. شكرا لكم.